Testing. Blah, 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 blah.
Ready, set, go.
It's time for the Coach Amy and Coach Liz show.
A podcast for endurance athletes by 2 athletes, 2 coaches, and a physical therapist.
We are your hosts, Coach Amy
And Coach Liz.
coming to you from
Kansas City.
So today our topic is about percussive devices, otherwise known as massage guns. And we're going to talk about that in just a second. But first, Liz and I haven't met for 2 weeks in a row. And Liz, I want you to tell our listeners, where have you been? What have you been doing?
I have been helping in an alpaca farm.
Shearing?
I've been shearing alpaca.
Okay, so tell us about that. Just a little bit. What does that entail?
They are glorious. Well, at the first weekend of May every year, they have to get shaved because they get really hot. And so there is a little rescue alpaca farm that is in KCK. And so every year, the first week of May, I go help them shear the alpacas.
Okay.
They're glorious.
That's so fun. Probably very therapeutic.
It is very therapeutic.
Multi-talented Liz. Tri-coach, triathlete, and farmer.
And they have little razor nicks all over them. No, they don't.
No. Okay. All right. Well, so the question here today is, and I get this a lot, is should I use a percussive device or massage gun to treat my injury or delayed onset muscle soreness? And my answer is going to be no. And here's why. Here's why. Hear me out, because I know there's going to be people that use them. Liz. And a bunch like half my patients.
I know. I just have to say, every time somebody comes into my clinic to get a massage from me after seeing Amy, they all confess to using their massage gun. And we all agree we can't tell Amy. So I'm coming clean right here.
Okay. Dang it. All right. So hear me out. Because the reason that I don't recommend it is because the risks outweigh the benefits that you could get from it. And there's also so many other ways that you can treat an injury and delayed onset muscle soreness that don't have the same risks. So that would be my number one main point there. I think one of the reasons that this is such an issue is because athletes in particular will associate like pain with stretching or massage as beneficial. Mm-hmm. And they'll be like, oh, it hurts, so it must be working. Like that hurts so good problem. But that's rarely the case, especially when you're treating delayed onset muscle soreness. And I think it's difficult for athletes to discern, when it's okay to feel discomfort with a self-treatment method like massage gun and, when it's not okay. Now, there is some research to support, there's limited research to support this, that the percussive device can help with, increasing mobility when used on healthy tissue. Okay. When operated by someone who knows what they're doing. Okay, but wait. So, Liz, there is this comedian, just on the topic of people who know what they're doing. His name is Tom Pappas. Have you ever?
Favorite. I love him.
He's hilarious.
He's the best.
So he does this bit about his elderly parents using the percussion gun.
No.
Okay, yeah, you gotta listen to it. So, y'all, we're gonna put it in our show notes. So you guys, you have to listen to this.
He's the best.
So funny. So, but anyway, let's talk about the risks and the issues and the problems. So, a percussive device, these like massage guns, and I'm not going to name any particular brand or anything, but you guys know what I'm talking about. The way that they function is like a jackhammer. Mm-hmm. So it's digging into the tissue. It's like poking into it as opposed to going back and forth sideways on the surface. Okay. You could damage nerves, organs, and blood vessels. And muscles and tendons. Okay, you can just do damage to these structures. And unless you have a thorough command and understanding of anatomy, it's very risky. You mentioned that you're one of those people that uses...
From time to time.
But what people may not know yet in this podcast, our listeners, is that you are a massage therapist, a trained and very experienced, been doing it for many, many years. And in order to be a really good professional massage therapist, you have to have a really good understanding of anatomy, and you really know your anatomy. So you are going to be less likely to injure a nerve or blood vessel or organ because you know where all those things lie. But there might be some things that you don't know. We'll enlighten you today. Athletes have a general understanding of anatomy. Like, you know where your hammies are, you know where your glutes are, you know where your calves are. You've learned this over the years as an endurance athlete. But you probably don't know where many of the nerves and tendons and blood vessels and organs reside. So I'm just going to give you some examples of some patients in my clinic who've improperly used a massage gun. And I have a lot. So I'll spare everybody like all of the examples, but I think it's going to be really helpful for you all, our listeners, to hear these examples when you're contemplating the use of this device. So here's one example. So one of my patients was attempting to treat their hip pain. And in this case, they have what's called psoas tendonitis. It is an injury to a tendon in the front of the hip. Well, this patient was like, oh, I'm hurting here. This is where I'm going to put my massage gun. Well, right near that area of pain that he's having is the femoral nerve, artery, and vein. And he was using the device on the femoral nerve. Okay. So not only was there a risk for all the vessels and nerves to be damaged in that area, but also he was using it also on an inflamed tendon, which we don't want to use the massage gun on that either. It can also cause damage to like ligaments, bursa, and muscles. And you're thinking, well, I want to treat these things, but the unfortunate thing about the massage gun, again, that jackhammering mechanism can injure and inflame the connective tissue even further. Another example is a patient who tried to treat her sore glute, right? We oftentimes have sore glutes, but what she didn't realize that she was aiming the gun at her bursa. A bursa is a fluid-filled sac, and it resides in the same area where she was having pain in her glute. So all she was doing was, causing more inflammation, like literally just bruising that bursa. The moral of the story is, if you don't know your anatomy, or if you operate on the theory that if it hurts so good, or it's okay to be causing pain to this structure, you could actually be causing more damage. And it has to really do with the mechanism of how that digs deep into the tissue and pounds on it in a jackhammer-like fashion. There are a bunch of other scary, horrible, scary things that I think are worth knowing, like fractures, deep vein thrombosis, and rhabdomyolysis. But I am not going to scare our audience with that right now. But if you do want to know more, we will have a link in the podcast to an article I wrote that has more details about those issues that can occur. Liz, do you have any questions now that you know?
Okay, well, so there are a lot of us who actually do have massage guns. Yes. And do use them. So truly, though, if you are somebody who wants to know how to use it and not hurt yourself, I mean, what do you do? How do you figure that out?
Yeah. So, don't go throw it away.
Yeah.
Don't go throw it. And I have a patient who came and said her husband bought her one for her birthday. She doesn't want it, but I'm like, he's like, yeah, that's your gift. So I said, all right, well, hey, just bring it in and I'm going to show you how to safely use it, especially for the issues that she's having. How could it be helpful? Here's how to do it. Sure. And then watch her use it and make sure she's doing it safely. I think that's finding a professional that can help you with it so you don't have to throw it away. Just make sure you're doing it right and that you're doing it for the right reasons and not hurting yourself. That's my recommendation.
Yeah. And especially for people who are inclined really more pain is better and they really dig in, maybe having it just a check and balance on that.
Yeah.
And some instruction.
Yeah. Okay. So don't go throw away your percussive device quite yet.
Set yourself up for success.
Yeah.
I do have a lot of athletes and also massage clients that come in and ask about other, like vibrating foam rollers or massage tools. This is a family show, so we're going to keep it clean. And so maybe you could talk about, the difference between what that, the way that massage gun really nails into the skin versus using some of those other things and how they're working.
Yeah. So because those devices do not create a downward force, and so they're gonna be more maybe even like a sander, if we're gonna stick with like tools analogy, is it's going back and forth sideways rather than pounding deep into and down into a tissue. And also like vibrating foam rollers and most vibrating massage tools have like a larger surface area that they're using rather than like some of these guns that you will see have these little tiny heads. Okay. So the direction of the power is spread over a larger surface area and it is going parallel to the tissue instead of straight down into it.
Okay.
Yeah. But, and that's if you're, trying to treat something that's like a delayed onset muscle soreness. If you have an actual injury, that is something to talk to your physical therapist about, like, should I be using this and then where and how in terms of the vibration massages or vibration foam rollers. Yeah. So into your health.
It's very convincing. It is compelling.
Okay. Spread the word.
Well, I will tell people to stop using their percussive jackhammers on their muscles.
Thank you.
Thanks so much for listening. And remember,
We are in this together. Until next time.